Asthma in New Mexico by Greg Jackson, Chemistry Class 4920 at Valdosta State University. Asthma. Asthma is thought to be caused by a combination of genetic and environmental factors. It is a common chronic inflammatory disease of the airways characterized by variable and recurring symptoms, reversible airflow obstruction, and bronchial spasms. Some of the main causes for asthma are as follows: parents who have asthma, respiratory infections during childhood, contact with some airborne or allergens, or exposure to some viral infections in infancy. Some of the symptoms for asthma are wheezing, shortness of breath, tightness of the chest, and breathing temporarily stops. A few drugs to relieve asthma are albuterol. Albuterol is a short-acting drug used for the relief of bronchial spasms in the conditions of asthma. The doses for albuterol are 1 to 2 inhalations, 1 minute each, repeated for 15 minutes as needed. The modes of actions for albuterol are: it acts selectively on the beta 2 receptor sites in the lungs, relaxing the bronchial smooth muscles, decreasing the airway resistance, and relief of bronchial spasms. Also, corticosteroids can be used for the treatment of asthma. They work by dampening down the inflammation in the airways. The dosages are: patients are recommended 25 milligrams per inhalation. The mode of action is it acts on the cell membranes to alter ion permeability. Albuterol is another drug used in the treatment of asthma. It prevents and treats wheezing, shortness of breath, and coughing. 2 to 1 puffs are inhaled orally and repeated every 4 to 6 hours as needed. The modes of action for albuterol are the stimulation through beta allergenic receptors of the intracellular adenal cyclics. This slide shows albuterol. It is functionalized by the amine group and the 3 hydroxyl groups connected to it. On the left is a 2D structure of albuterol. On the right is the 3D molecule. All steroids have 3 6-member rings with a 5-member ring attached. Corticosteroids is depicted in this slide. On the left is the 2D structure, and to the right is the 3D molecule. Albuterol has a similarity to albuterol. The only difference is that there is a nitrogen instead of a carbon in the six-membered ring. Depicted on the left is the 2D structure of perbutyrol, and on the right is the 3D structure of perbutyrol. Mexico City. Mexico City is the federal district and capital of Mexico, and the seats of federal powers of the Mexican Union. Mexico City area is 573 square miles, and the population as of 2010 is 8,851,080 people. The life expectancy is 76.2 years. Mexico City suffers from numerous environmental issues. The federal and local governments have implemented numerous plans to alleviate the problems of air pollution. They also have a problem with particulate matter and smog. This is due to the large, dense metropolitan area. In Mexico City, mainly in the Children's Hospital, thousands of kids who suffer from chronic asthma across the city influctuate the hospital. The pollution itself does not cause asthma, but the mixture of hundreds of different particles in the air exacerbates the problem, Dr. Juan Jose Ciernes says.